campaign. What the Young Emerging Leaders have been able to do through the Y Plus Global and then Love Alliance funding, we've been able to mobilize digital advocacy, strengthen youth-led research, and amplified the lived experiences of young key populations across Africa and beyond. And also highlighting the efforts and gaps in HIV financing and programming for young people in their diversities. And also, we have worked towards co-creating of new resources on advocacy and funding priorities for young key populations. Also, just to add that today, the World AIDS Day, the webinar will mark a dual milestone, which is one, the launch of the resource which we will be showing you all today, and also the graduation for the Young Emerging Leaders cohort third edition, as well as, it's been something that has been instrumental to shaping young key populations in advocacy, understanding how to do strategic advocacy, how to engage policymakers and what have you not, right? And also serve as a reflective close to the bold voices, shaping equal futures campaign, and also spotlighting youth-driven solutions of sustainable funding and meaningful engagement of young people in HIV response. And you will agree with me that young people have been vital in addressing issues around HIV interventions, ensuring that our voices are heard, ensuring that programs are being made available for us, and ensuring that we are meaningfully engaged in all of the processes, down from the inception to implementation and to dissemination of all of these interventions. Very quickly, I'll be sharing with us what the objective of the webinar is. One is to launch and disseminate the advocacy tool, which has been developed, that shows what advocacy and funding priorities for young key populations are, and also outlining key recommendations to donors, policymakers, and program implementers, and also to celebrate the milestone and achievements of the Cohort 3 Young Emerging Leader Program and the contributions it has made to shaping our advocacy and leadership skill. Also to reflect on the impact of the Bold Voices Shaping Equal Futures campaign, and to share lessons for sustaining youth engagement beyond 2025. Today we have very great panelists. And amazing that we have some who are the Young Emerging Leaders, and Ravel is one of us. Is an advocate from Burundi. I'm excited to engage with you. I've heard so much about you. I've seen you on Twitter, and it's nice to engage with you here on the webinar. I would allow the panelists to introduce themselves, starting from Mary Ann Wambugu. If you're on the call, please can you introduce yourself to us?
Yes, I'm on the call. Good afternoon, good evening, good morning, everyone. My name is Marian Ombugu. I am an emerging leader from Kenya, and I also sit in the country coordinating mechanisms in the Global Fund, representing the
Hi, Marianne. I don't know if you're on the call.
Can you hear me? Can you hear me?
You can introduce yourself.
Can you hear me? Am I audible?
We hear you, Marianne.
Okay. Do I need to reintroduce myself, or you had me?
You can start again.
Okay, thank you. Good afternoon, everyone. My name is Marianne Wambugu from Kenya. I am emerging leader, and
hi everyone. Hi, Marianne. I don't know if you're on the call. I can't hear you. If you're on the call, please introduce yourself to us. Tell us about yourself, what you do.
Okay. Confirm you can hear me now, Joe. I don't know if the rest can hear me. They can confirm on the chat box.
Hi, Marian. I can actually hear you. I think Joy is having connection
Okay.
problem.
Yeah. Don't know. Ivy, should I assist or what do you do?
Yes, please proceed as I discuss with Joy about her network. Just proceed.
Okay, thank you so much. I will reintroduce myself once again. My name is Marianne Nambuku. I am a young emerging leader in Kenya and also I sit in the country coordinating mechanism for the Global Fund representing young people. It's really a pleasure to be here to even end the year and celebrate the World AIDS Day with all of you. Thank you, and over to you, Ivan.
Thank you, Marianne. We will go to Ravel. Ravel, please introduce yourself. And please also put on your camera to introduce yourself.
Yeah, thank you. Can you hear me and see me?
Yes, we hear you.
Hi, everyone. Good afternoon, everyone. My name is Rebecca Toto, and I'm from Burundi. I work with an organization called Homode, where we amplify and empower young LGBTQI+ through education, health, economic empowerment, and social justice programs. Over and looking forward to this discussion. Yeah, over to you, Ivy.
Thank you, Ravel. Edgar, please introduce yourself.
Yes. Hello, everyone. It's evening here in the Philippines. So I'm Ed. I'm one of the young emerging leaders under the Y Plus Global and Seven Alliance program. And actually, I think I'm the only Asian from the cohort. But locally, I represent Free to Be Youth. It's a network. It's a national network of sexual and reproductive health organizations here in the Philippines that is now championing pleasure-based approach to HIV education. But at the same time, we also champion youth leadership in HIV spaces, may that be nationally or locally. So yeah, I'm excited for today's discussion. Nice to see you all.
Thank you so much, Edgar. Joy, are you okay now? Can you take it up?
Yeah, I'm back. Can you hear me?
Yes, please proceed.
Okay.
Everyone has introduced themselves, so you can go to the next phase.
Okay, thank you so much, Ivy, for helping out. Sorry, my network is a bit acting up. So we'll be going to the next activity here, and we'll be having Ravel, sorry, so I don't murder your name and you sue me to court. So Ravel, thank you so much for making yourself available to be part of this webinar. So to setting the scene, and I mean, looking at commemorating World AIDS Day as well, and talking about communities leading change. So highlighting why young key populations advocacy and funding equity matters. Can you share with us why does funding equity for young key populations matter beyond just financial support, and how does it shift power within HIV, SRHR, and social justice movements?
Thank you so much, Joy, and greetings again to everyone for joining us. And today I going to unpack why young population advocacy and funding equity matter. And first to start, it is actually about power, who holds it, who defines the narrative, and who set the priorities. And I have tried to summarize some points which we go through this discussion. And I will say that funding equity matters because it shifts power from for us to led by us. And we've noticed that for many years now, young population, we have been invited, we have been represented, but where we have trusted with full decision making power. And most of the time, we are funded through short-term project for 1 to 2 years, and which the projects are very helpful. The programs are very helpful. We've been able to be empowered in so many ways when it comes to HIV, sexual reproductive health, social justice, knowledge, and even movement building. But unfortunately, those short-term projects, they keep us stuck in cycles of temporary activism and system. And they keep us surviving, not transforming. And if we want to talk about power shifting, I would say that we have to understand who we are dealing with. And we need long-term funding, not temporary project. And also we need investment in leadership, not just for service delivery. And I would say that this point of leadership, I'm gonna develop it after, but we need to understand who are we fighting with, who actually holds the power within our movement. And long-term investment allows us to build strong institutions and systems. And now let me come back to the leadership point where I was talking about, when funding equity is essential for us because of the anti-right movement, on how we can see they are very organized. And I've seen that during this discussion, we do have some people from Uganda and even Kenya. And I would say that the anti-right movement is very organized, very coordinated, and very well funded. And they invest in their youth, they train them, they invest in leadership for 10 plus years project, they invest in civic education. And I believe that we do have to do the same, because I believe that education is a powerful tool for power. We need to equip young people for long-term leadership, right? And I would say that when you see that they train their youth from a young age, they build long-term leaders, and they are now the ones making the decisions. And I would also say that funding equity matters because young population, we must be part of the intersectional health system. And for years, funding for HIV and sexual reproductive health has been around prevention, have been around awareness, and has been around sensitization, which is very good. But we've noticed now we do not have the power to tackle any pandemic. And for example, I can give the recent COVID-19 arrived, and we saw so many consequences. Our system were shaken. Our communities were surprised during the COVID-19, and also our organization struggled to adapt the transaction between HIV and COVID-19. And we then realized again how underprepared we were. Funding equity means that we must be part, and donors must invest in us in terms of that, so that we can be able to be part of any pandemic preparedness, part of also the research research as well. And I believe that transforming the AIDS response is impossible without transforming who holds the power. And who holds the power comes first with knowledge, and be able to be strong in any kind of threats that may come when it comes to pandemic, when it comes to funding. And that is how and where we have failed as a movement. And that I believe that the structures now and associations are trying to tackle this kind of issues. And for my last question, when it comes to, from my experience, what happens when young key populations are excluded from funding decisions and advocacy spaces, and what changes when they're meaningfully included in resources. So I would believe that, from my own experience, exclusion has created competition, not collaboration. We all do the same work in a different context. We do a lot of work around HIV, around LGBTQI+, around sex workers, help people use drugs. And all the stuff is somehow the same, right? But what is different is the context that we operate in. So exclusion means that it will create more competition than collaboration, which means that when young people population, when we are excluded in rooms, funding we go to the people who are in the room. And we often see that funding is now very difficult to get because we are not in the room. We are not visible enough for us to get the funding directly. And this leads to two very harmful consequences, which is our voices becomes harder to amplify, and also the funding becomes a competition, as I say, not a movement building. And when included, we gain also access to accurate, up-to-date information. For example, I would say that one of the wisdom that, from my experience, I would like to share is the HIV cure literacy work that we are starting soon. And I was the very young person in Burundi to be part of that program. And it shows that in coming from a very conservative and limited resources country, it was very hard for us to get this kind of information. But I'm living proof that I was resourced enough, I was equipped enough, I was educated enough to bring back the knowledge into my communities, which means that we will not see the HIV cure research as a scientist work, or as for the developed countries like South Africa or Kenya who are more advanced in this kind of uh, young people being part of the HIV cure research and literacy. So this is somehow a wisdom that if we are included, we have access to information that was previously out of reach, and also we understand scientific development like HIV cure research, and also we can bring this knowledge back home. And I'm so grateful for the global network of young people living with HIV, where they're committed to equip, to educate, and to empower young people living with HIV and young people population in general to lead the change. And I think that it's very essential to keep doing that work, because without us, there's no future. And yes, and thank you so much again for giving me this platform to highlight this, why young population advocacy and funding equity matter. Thank you so much, Joy. Over to you.
Hi, Ravel. Thank you so much. That was so insightful and that was powerful. I was able to pick a few things, which I think are really, really key that we all actually take cognizance of, which is understanding and knowing who holds the power actually. Because in all of these things we do, in all of the advocacies we do, if we don't meet the right people who are in power and who are able to create this change, then I mean, it's as good as not even doing anything, or is as good as putting resources in the wrong places. Also, I mean, I love the fact that you talked about the anti-rights movement for YKPs. And I mean, they have this synergy, they have this understanding, they have this collaboration in which they really fight. I mean, and I think one thing that is missing in I mean, the whole of the advocacy we do as young key populations and as network of people living with HIV is the fact that there is still a gap, right? And then there's need to be collaboration. I mean, that's what is missing. A lot of young key populations now, especially with the different implementations going on, the different funding available, you could see that most times there's what do they call? There's a disconnect, and then if there's a way we could come together in collaborations to work in synergy, then I mean we can also be able to match up the anti-rights movement, because I mean it's true that they really have that power, like you said, and right, understanding that I mean young key populations must be part of equitable health system, right? It's something that it needs to be important. We can't just do activities and sideline these young people, because I mean, we are key populations. We wear the shoes. We understand how this thing works. And if we are not having the services, equal rights as general populations, then I mean, it's not making sense. I love the fact that you highlighted that. And I mean, you also mentioned that transforming age response is not possible without changing who holds the power. Yes, it's just that that's what it means, because I mean, we can't transform the HIV response if we do not have everybody who is vital to ensuring that we end the epidemics on the table, right? Thank you so much for highlighting that, and also thank you for sharing the experiences throughout your work. And you agree with me that Y Plus Global have been doing a lot as to empowering young people, and we appreciate them. We love them for all they do, because I'm also a product of Y Plus Global. Thank you so much. Thank you, Ravel. So moving on to the next um, activity on the agenda is the launch of the advocacy resource, which is advocacy and funding priorities for young people. And this presentation was to be taken by Ivy, but due to some certain reasons, she won't be able to do that. And I'll be presenting on behalf of Ivy. Okay, thank you, Tiwanda. I think it's already on the screen, or you can just help share your screen for that presentation. So here, the Young Key Populations Funding and Advocacy Priorities for the HIV and SRHR response. Next slide, please. So just a quick introduction to show that young key populations, including sex workers, LGBTQI+ youth, and young people who use drugs, and adolescent girls and young women continue to face heightened risks of HIV and barriers to SRHR due to stigma, discrimination, restrictive laws, and limited access to youth-friendly services and social services. Also, data from the UNAIDS Global HIV and AIDS Fact Sheet 2025 show the global HIV prevalence among adults aged 15 to 49 remains at 0.7%, but the burden is disproportionately higher among marginalized and criminalized groups. I think that will be done later in the group. Okay, then looking at the respondents' profile, so surveys was gathered to get responses from, responses was gotten from 32 organizations across 13 countries, with the largest representation from Zimbabwe with 18%, Kenya 18%, Tanzania 10%, and Nigeria 10%, followed by Zambia, Uganda, and United States, each having 6.9 percent. Smaller proportions were drawn from Ghana, Eswatini, Namibia, Mauritius, also Uruguay and Peru had 3.0%. In terms of population group representation, 46.7% with the LGBTQI plus community, 53.3% of respondents worked primarily with sex workers, 23.3% with young people who use drugs, and then we had 36.7% with adolescent girls and young women, and a small minority of 3.3%, which focuses on youth in prisons or other closed settings. Next slide. So now, evidence and arguments from this study showed organizational needs and funding priorities. When asked about the type of support they need most to strengthen their work, nearly all respondents, around 93.8%, identified funding and financial resources as their top priority. Also, looking at what remains unaddressed as key funding priority affecting key populations in the various countries that had to take the survey. I mean, when asked what key priorities remain unaddressed in their countries, we had like 100% cited the need for sustained funding. I mean, and it's common in every country, in every intervention. Most times when there are funding supports and that funding support ends, the issue of sustainability for an intervention that had already started might be a problem. Also looking at the question around government's contribution to equity and access to funding. So perceived government involvement in ensuring equitable access to funding was rated on a scale of 0 to 5. Only 3.1% of respondents rated it as very high, which is 5, while 25% said governments were not involved at all. So yes, for I would say for Nigeria, my country, so a little from the government is being done. So those countries that have a high representation, I mean, it's a good thing. But then in most African countries, we're having an issue of government involvement in ensuring equitable services for young key populations, and we hope they do better. Next slide. So now we looked at what the advocacy priorities are. The advocacy priorities were remarkably consistent among respondents. So every respondent, 100% identified stigma reduction and social inclusion as central to their advocacy efforts. This was closely followed by access to quality healthcare services, which 90% of respondents highlighted, including HIV, SRHR, and mental health. Additionally, 84% emphasized the importance of policy influence and legal reform, while 71% focused on equity and inclusion. Next slide. Now, recommendations for local governments is to institutionalize youth participation in governance, enact legal and political reforms, scale integrated youth-friendly services packages, strengthen transparency and accountability, and establish youth-friendly funding mechanisms in all local government areas. The recommendation for external funders and partners is to shift power and funding directly to youth-led organizations. I mean, it is necessary because most times when you give funding to, for example, you have a body and you say, so this body should host, let's assume the government should hold this funding and every other youth-led organization should tap from this funding. Sometimes it is usually reverse is the case. Sometimes you get this funding, sometimes you do not even get the funding, sometimes the fundings are not enough. And these are due to bureaucratic issues, political issues, and all of those things that go on. So, there should be shift of power and funding should go directly to youth-led organizations, adopt participatory grant-making models, peer financial support with institutional strengthening, invest in evidence and learning, and ensure inclusion, safeguarding, and equity. Thank you so much. And that was all for the resource. I think the resource will be dropped in the chat box for people who want to access it to actually look, or a link will be dropped as to how you could access this resource and probably go through it. So thank you so much. If there are any questions, you can just drop on the chat box. So we'll be moving on to the next session, which will be, sorry, I'm moving a little bit quick so that, I'm able to stay within the time frame. So we have 20 minutes for youth voices and reflections, and we'll be having a panel discussion with the Yale graduates who would be sharing their experiences, impact stories, and leadership lessons throughout this cohort. And the first question will be going to Edgar. Um, Edgar, if you can hear me, the question is: in what specific ways has Love Alliance influenced your leadership? Sorry. Okay, yeah. In what specific ways has Love Alliance influenced your leadership journey and your ability to create change in your community or movement?
Right. Thanks, Joy, for the question. I hope you can hear me clearly. If you could just raise a hand or like do a thumbs up just to confirm. All right.
Yeah,
Thank you
you
so
can.
much for the confirmation. So, definitely the program or my engagement with the young emerging leaders has influenced my leadership in so many ways. And I would say that participating in this program has been really transformative. But I guess for the interest of time, I'm just gonna share probably two insights. So in terms of how my leadership has been influenced by the program, I would like to highlight that the program has really helped me better understand what meaningful and ethical youth engagement looks like, particularly in HIV programming and advocacy. So, in the Philippines, HIV response, tokenistic engagement of young people is still very common. I, for example, have been invited in a lot of meetings at the last minute with no context or without any knowledge of the agenda that was going to be discussed in that meeting. And many of my peers, who are mostly students, missed also a lot of opportunities where they could influence programs and policies. And this is mostly due to the lack of financial support provided to them to participate. And we have also showed up to a lot of consultations, yet we're rarely involved in what happens next. And yeah, all of these experience have really frustrated me personally, and of course our community as young people. And so these frustrations, coupled with the knowledge and motivations I've gained from my Yale engagement, really fueled my commitment to change this or to transform this. Because I think I like the word transform better than change. So yeah, in 2024, I led the formation of Free to Be Youth, which began as a learning hub and has since evolved into a national advisory board that now represents young people across programming spaces. And with meaningful and ethical engagement at its core, our network has been able to demonstrate several innovations that are now being upscaled, no? And at the same time, we have also contributed to the development of several HIV related national guidelines, such as the proxy consent for treatment. Because currently here in the Philippines, if you're young, if you're below 15, you cannot proceed to treatment without parental consent, and that hinders a lot of our peers from enrolling in treatment, making them susceptible to developing advanced HIV diseases. But at the same time, we've also contributed a lot in doing the initial work for the introduction of injectable PrEP here in the Philippines. I know in some Western countries this has already been rolled out, but here in the Philippines, luckily, we're one of the few Asian countries who will soon introduce it nationally, and lastly, the network was able to create a continuing learning and networking space for more than 80 SRHR organizations in the country. Not to mention, in December 2024, December of last year, we hosted the largest gathering of youth leaders in the HIV response. It's called the Young People First Summit, to highlight that we want to put greater investment for young people and put greater priority to young people if we really want to, change the shifting epidemic. So in that summit, over 300 youth leaders participated, and all of them adopted the pleasure-based approach to HIV education, which was really the core mission of the summit. So yeah, I had a better appreciation and understanding of ethical and meaningful engagement. But secondly, the mentoring resources and networks I gained from the YEL program has definitely and significantly elevated my leadership. YEL, for instance, reshaped how I view mentoring from, before I used to see it as just a one-way transfer of knowledge, but now I see it as a collaborative, strength-based partnership. My mentor, who is actually Josephine Achieng, who's from Africa, and we come from different contexts, different continents, and I believe that diversity has really enriched the practical skills and insights that I gained from the mentorship that I now apply in my work in the Philippines. More so, I think the learning materials and opportunities that I gained through the YEL has also contributed to my work locally, because currently through the Free to Be Youth, we now serve as a resource tank for the 80 member organizations that we have. So we now maintain an online learning hub where we upload all of these resources, and we share all relevant capacity building and funding opportunities that our member organizations can partake in. And I guess being the only Asian in my cohort was also a proud moment for me, because opportunities like this are rare. And so I made sure that I maximize every moment of it. And so as I continue to do my local advocacy through Free to Be Youth, I plan to strengthen the collaborations that I've made with my fellow YELs across the regions. And I also envision creating a cross-continental learning space where young people can mentor and inspire each other. And so, yeah, I think those have been the ways the program has elevated my leadership, and I'm very grateful to have been given this opportunity. Thank you so much, Joy.
Thank you so much, Edgar. That was so much of experience. And I mean, they are amazing. Thank you for the amazing work you're doing. And I'm glad that, I mean, both myself, not just you, I mean, the Yale program have been able to shape and to help understand how we view mentorship differently, and the fact that it has been able to empower us to be able to do things ourselves that we literally could not do. I mean, it's commendable. Thank you for sharing, and thank you for the work you do. It's amazing. Um, so I would have Mary Ann respond to the next question. Um, Mary Ann, can you share an example of a project, campaign, or initiative you were able to lead because of the support you received through the Love Alliance, that such as the sub-grant, mentorship, or training? What impact did it have on you? Maybe you can share. Hi, Marianne, if you're on the call.
Sorry, I was speaking while muted. I'm really sorry about that. Confirm you can hear me?
Yes, I can hear you. Thank you.
Yes. Thank you so much for your question. And to respond to your question one, as a country, we're able to start a health financing movement to pay young people, because that was one of the spaces that young people were not tapping into. And also because of the USAID's stop work order, there was a lot of conversation on pushing for the government to do a domestic resource financing. And through the support that we got from the Love Alliance, that I got from the Love Alliance, we were able to establish a movement with the young people that is still, yes, in the baby step making, but we are sure that in the next year it will be a looming movement with the young people in the country. And then also with the support that I was able to get from the Love Alliance, especially during last year and this year when we were able to host the IAS virtual hubs, the two virtual hubs this year, even getting information about the Lena Kapave and getting to understand that even our country is one of the countries that have been mentioned to be the early adopters. So I was able to run with all that, and starting this month, I will be leading the social media of demand generation activities on Lena Kapave in the country. So through the support of the Ministry of Health, that is what I will be leading easier, and also because the Lena Kappa will be able to land in the country in January. So we were to start such project, and because of that support that I was able to get from the Love Alliance, then this is a very win for me and also for the young people that I will be asking them to uptake the PrEP or the prophylaxis that will be in place. What impact did all of this have? The impact is one, is that young people are now, a lot of times when young people are told about numbers, and even from the history that not everyone loves math, you know, and this is a space that I feel like, are we going to talk about mathematics? Are we going to do mathematics and all that? But getting to have an intersectionality of the impact of a government not allocating resources for the health of the people who are serving them, and even from the citizens who are paying taxes, it's very, very important. And I'm happy that these were the projects that young people were really open to discuss about them, and young people were really, really willing to support, because every other person is like, the US has left us, so who are we left with? We've been left with the government. So if that is the only way that we can be able to come in and ask the government to allocate resources for HIV, for TB, for malaria, for every other endemic diseases, then we as young people are willing to be part of the movement. So the impact is we are really creating a very huge movement, and also for the impact that for the Linasapa for me, honestly, if yesterday was celebrating the World AIDS Day in the country, and we will be the data that was presented was not very pleasing, especially among adolescents and young people, even in Nairobi County, which is our our capital center, our capital city, sorry. And for me, leading the Lenakapa will mean that in the next World AIDS Day, we will not be saying that young people are still living in new HIV infections in the country. And I am sure that I will stand to be counted as one of the young people who are really pushing for self, and self-care among young people. For me, even Lena Kaperi is part of the self-care. And because there has been a lot of conversation about um, PrEP being a lot of pill burden, and even because young people asking themselves, so I am not unwell, I am not HIV positive, so why do I need to take this? So for the twice a year injection for me, it's really a turnaround, and I'm really standing to be counted in this, and I'm really happy that through the support of Lava Land, the Ministry of Health has entrusted me with such kind of movement, and also being part of the committee that has been looking into where exactly which facilities are the best place facilities for the Lena Kappa, or even who are the target audience for Lena Kappa, and even being in such a position has enabled me to champion for a target group for adolescents and young people, because a lot of time when you're not on the table, no one would speak for you. But getting that opportunity to be on the table and to speak for the voices of young people, for me honestly was a thumbs up, and I'm really hoping that starting January, young people will be saying, at least now, Miriam, I've been able to get the Lena Kapere. Where else can I refer my fellow young person in maybe from a different county? Yeah, thank you so much. Over to you, Joy.
Thank you so much, one boy. Sorry, I said one boy. Sorry. Thank you so much, Marianne. That was amazing, and congratulations on your new role. Um, I'll be moving to the next question. So you and Edgar will be responding to the questions, but then you go one after the other. The question is on so what is the most important lesson or mind shift you will carry forward from the Love Alliance experience into your future leadership or advocacy work that you would be doing going forward? I don't know who wants to go first, Edgar or Mary Ann, or we can just start from you, Mary Ann, and over to Edgar.
I can start.
Yeah, you
So
can
for
go on
me,
and Edgar come
thank
later.
you so much. Thank you so much. Before Young Emerging Leader, a lot of time we're usually called just as participants, and even as young person, we will just get emails, calls to just participate. But I truly didn't really understand what exactly does that call for. And being part of the Young Emerging Leader made me to understand that I am not just a participant, but I am also an expert. And even getting to understand what exactly does it really entail for young people to be engaged meaningfully. And for me, even from what we had seen throughout the process is the respect and even how Y Plus Global were open to understand the lived experience of young people and also to design advocacy with communities rather than for us. No, we just say nothing for us without us. But for me, I would really stand on top and say that Webers Global really understand what um, meaningful youth engagement really means, and even treating young people as experts really means. And that is one of the key issues that I will run, even lead uh, in my advocacy work. So for me, even now, I can strongly lead in a stronger commitment for meaningful youth engagement and even share power with the young people and evidence-based advocacy. Which a lot of time we've just been saying evidence-based, but do we truly mean what, do we truly understand what evidence-based advocacy really means? So for the young emerging leader and the White House Global, that is key issue that as for me, as a young leader, in the different spaces that I sit in, I would really learn with. And even now, as we are heading towards the cycle 8 writing next year, that is one key issue that in my leadership I want to employ. And also, I have really learned what sustainable change really mean? And also, how exactly are we going to guide the agenda for the young people? How exactly are we supposed to shape the agenda and the voices of young people? How are we even supposed to create an urgency for the young people and even shaping the interventions and ensuring that systems are accountable for us? And even from the presentation that you did, it was really important that the government clearly understand what youth engagement and even the youth-friendly centers are supposed to provide. So for me, it's to ensure that I put systems accountable based on even the trainings that we've been engaged by Y Plus Global and a young emerging leader. And it has also showed me what community-led advocacy really means, and even community-led right-based mindset really means. So I'm running with all of that, and I'm sure that Y Plus Global will be able to see my work, and also young people in Kenya and beyond will be able to appreciate the kind of mentorship and the training that I've been able to garner from Y Plus Global. Thank you.
Thank you so much, Marianne. Edgar, if you can also share from your point of view.
Yeah. Um, So actually my insight is pretty similar with the insights of Marianne on ethical and meaningful youth engagement. But I think I just like to complement it by saying that it's really the practice or the framework of co-creation that became the change driver for me as a young leader. And I consider this to be my biggest or the most important lesson that I've learned from my engagement with the YEL program. So because before joining YEL, I honestly didn't have a name for this kind of approach. I just knew that something was missing in the way young people are being engaged in the HIV response here in the Philippines. So it was through the program that I finally learned the framework, how to actually do it, how it happens in actual context, and also saw how powerful co-creation can be when it's done the right way. And it's pretty much relevant to this year's theme for World AIDS Day. It's overcoming disruption, transforming the AIDS response. And as a young leader, I truly believe that co-creation with young people is one of the ways we can transform the AIDS response. And I've seen this firsthand in our work at Free to Be Youth, that when young people are treated as partners and as co-equals and not just merely, beneficiaries, we show up differently. When young people are treated as partners, trust grows, accountability becomes shared, and our leadership really thrives and flourishes. And when leadership thrives, when youth leadership thrives, innovation naturally follows. And this is very important now, especially as the landscape of HIV prevention and treatment keeps evolving. And young people need responses that actually, speak to their realities and adopt to the advancing environment. So yes, co-creation is the most important lesson that I've gained from my Yale journey, and it's something that I will, continue to carry with me and champion as I grow my advocacy and leadership here in the Philippines. So yeah, thank you so much, Joy, for this opportunity. Or is Joy still here?
I think she dropped. She's having issues with the internet. But thank you so much, Marianne, and
It's
thank you,
okay.
Edgar, for your reflections. I think I have enjoyed listening to both of you and understanding the depth of the work that we've done throughout the year, but also for the YEL program this year, it was engagement of alumni, meaning this work started either 2 years ago for some or 1 year ago for some, and we've seen how transformational and co-creation engagement looks like, and as you've said, how it shows up differently compared to one directional approach or a top-down approach. So thank you so much for your perspectives. And I am not sure if we have the other young emerging leaders, but we are moving towards the end of the session today. And I would like to hear from the other young emerging leaders, just a few insights. I know that they're not prepared, but I wanted for this to just come out of the top of their head on what they can describe as the greatest change of being engaged as a young emerging leader within the years that they have engaged in. And I hope Sharon is on the call. Hi, Sharon, are you on the call? Okay. So I would like to hear from Sharon, Catherine, and Wamboi, just briefly on what or how the Young Emerging Leaders Program has transformed their journey and how they intend to utilize that moving forward. So Tawanda, please make them panelists so that they're able to speak, starting with Sharon, then Catherine, then Wamboi, and then I'll hand it over to Joy to close it off. Over to you, Sharon.
Hi, everyone. I hope you can hear me. Sorry, I cannot be on camera since I'm just ambushed. But yes, I'm here. I'm happy to be here. And yes, what a great journey being a YEL 2024-2025 for the whole 2 years, it has been really a very great milestone for myself and for the young people that I lead in my organization that was founded under the YEL program. So it is a great milestone, a lot of insights, a lot of learnings, a lot of platforms that I have really been able to like engage just because I'm a young emerging leader. And I don't know even what to say and what not to say. But yes, I am strongly and confirming that I am a great, great product of the young emerging leader through Y Plus Global and support from the Love Alliance. And I'm really so grateful to be one of the YELs because I mean, I am up here because of the program. I managed to form an organization that supports the young people living with HIV in my country, including the young key populations, youth with disabilities, and more. So it is an organization that that is really rooted by Y Plus Global. And yes, I might say that yes, I am now the chairperson steering committee of Y Plus Global Partners. This is a very, very great, a great milestone for me to lead the partners of Y Plus Global. I cannot say that, yes, I came into the year program when I am able to really speak like this or maybe be a leader like who I am right now. I have been on 2 global platforms. I have been supported by Y Plus Global to attend youth conferences, to sit up there, to speak on webinars. I am now really a great, great leader, and I did not even want this to end. I don't know. I wish it could really go more because I really, really wanted to be a baby still through the year program. And yes, thank you so much. I won't say a lot. I would love to give my other colleagues to also have a word. And yes, over to you, Ivy. Thank you.
So I think Catherine can go on. Either Catherine or Wamboye, whoever is ready, can go on.
Hi, everybody. Good morning, good afternoon from wherever we are all joining from. It's really a pleasure to have everybody joining in and supporting on the youth and on the YEL program. Personally, I'm a young emerging leader from 2023 and supported partially in 2024 and also a YEL in 2025. And one of the greatest outcomes from the Love Alliance for support for the YEL program is that as young people, we have personally and speaking of on behalf of others, I think we have all greatly learned from this program because of the finances. When it comes, most of us had issues on the budgeting, finance reporting, narrative reports. These are some things that as young people we have really learned through the program. And we also started an organization. I think some of us started their own networks under this program, and the Y Plus has really supported us on how to shape our own organizations when it comes to what really works in an organization. Also, on the Marianne has mentioned on the health financing movement, and that was one of the great aspects that the young emerging leaders from Kenya we have done, and it's thank you so much for the support, and I really hope that in future there are gonna be other young emerging leaders who are gonna be supported, so that they can have an impact in their own countries and in their own communities on projects that they are going to lead. Yeah, so that is from me, and thank you for the support in webinars, in conferences, and it has really shaped us in the leadership space and also in making our voices heard through advocacy. Thank you so much, Joy. I think I'll pass it over to Wamboy.
Wamboye, if you're on the call, please, you can share briefly with us.
Yeah, I think Tanda needs to make them panelist. So Tanda, if you could do that, Wambuichege.
Hello, can everybody hear me? Hello.
Yes, we hear you, Joy.
Okay. I think if that's all, I really want to appreciate everybody for joining the call today. Sorry, I'm unable to put on my camera at this moment. It's been an insightful one, having to hear from Ravel, the panelists, and the experiences of what the Young Emerging Leaders program have impacted in us so far. And we want to say a very big thank you to Y Plus Global and Love Alliance for the opportunity to be part of the cohorts and for the opportunities to be able to implement projects and be able to own the process. And to everybody again, thank you so much. And I hope that we are able to continue beyond the space, beyond the funding, that we are able to still come together to put up great ideas and to work. Edgar shared that if there's a possibility to have like a learning session that we can as well put up together, it will be of great impact to all of us. Thank you so much once again for the opportunity to moderate this session. Ivy, I don't know if you have anything to add.
No, Joy, just to say that I am really grateful as well for the opportunity to learn from all of you and to learn through the experience. And I know that this is just the beginning of greater things that we'll do together. Sorry about that. And I hope that we can continue the conversations and the partnerships that we've formed here. I'm glad that a lot of us have connected beyond being peers in the Young Emerging Leaders program, and we're now colleagues. We co-own or co-lead organizations, we co-lead movements. So this is very transformational for a lot of us, and I hope that others are able to learn from the framework of the YEL program. And yes, let's keep in touch. Thank you, and over to you, Grace. We'll share the presentation as well as the link to the toolkit. Tawanda's also shared it in the chat, so you can use it for your advocacy and for any other purpose that you want. Yes, we couldn't hear you, but we are glad you are here, and we understand that maybe it's a tech issue. Thank you, and over to you, Joy.
Ivy, there was a question on the chat box.
Oh, sorry. Let me have a
No
look.
problem.
Yeah, there's a
Can
question
we
in the
all
chat
put
box.
our cameras on? Maybe take a picture briefly.
Joy, there's a question in the chat box. So if one of the panelists can address it, and then we can close off.
Okay, that's fine. Please go on.
The question is, what is movement and shift of the world on climate change impact on our health, especially on HIV and SRHR among young people? And how can we integrate these issues to reduce new infection of HIV? Marianne, would you like to go first?
Yeah, on that question, I remember this year when we had floods in our country, there was a lot of issue of adolescent girls being sexually violated and all that. But as a country, honestly, as a country, we were able to respond as quick as we can to ensure that the girls or even the women are getting safe spaces where they can get services, and also they can be protected from people who want to sexually violate them. And even from the guidance that we've already received from the Global Fund, this is one of the direction that they're heading to in climate change. So probably George I would really urge you to maybe if you have a CCM representative that you know, you can link up with them so that now you can be part of the young people who want to address key issues on HIV and SRHR, even in the coming grant. But as a country, again, we are working to integrate HIV services and SRHR services at the facilities. So key thing is to ensure that our systems respond to any climate change issue that arise, and also our our systems are resilient for any form of pandemic, be it climate change, be it another form of maybe COVID, for example. But as young people, even as part of the Y Plus Global, we've been working closely with the young people to clearly understand how to protect themselves from being infected with HIV, and for those that are living with HIV, on how to um, have maybe a good life and a positive for that. Yes, thank you. And I hope I have responded to you, George Lazaro.
George's hand is raised. So I don't know if they still have a question. Tanda, you can allow them to speak so that if they still have a question, we can address it. We still have a couple of minutes. Okay, I think the question was addressed. Is that what you mean, George? You're able to speak now, so you can speak, George. Are you able to unmute and speak, George? Okay, over to you, Joy.
Thank you so much, Marianne, for responding to that question. And I don't know if we can all put out our cameras for a brief picture very quickly. Tawanda, can you help take the pictures from your end? If that's fine.
Yes, Joy. Everyone, if we can be able to turn on our cameras for the picture, let me also turn on mine.
Finally, we get to see the face.
Okay. Yeah, I'm starting to see people. Thank you, Ivy, Marianne, Ravel, Joy. Okay, I think that's it. Okay, so on the count of 3, I will take a screenshot. Okay, 3, 2, 1. Great. That was lovely. Maybe we do one more. Okay. 3, 2, 1. Wonderful. Thank you so much, everyone. Back to you, Joy.
Thank you. Thank you so much, everyone, for joining. Happy New Month. And to everybody that will be going to ICASA, a safe journey to you all.
Bye-bye.
All right,
Thank you. Happy
bye.
Valentine's Day. Bye-bye.
Thank you, Joy.